Dartford and Gravesham NHS Trust and Guy's and St Thomas's NHS Foundation Trust have come together to form the Foundation Healthcare Group, one of 50 Vanguard sites selected by NHS England as part of the New Models of Care programme. The NHS 5-year Forward View report highlighted the need for joined-up working across the NHS so patients get the highest quality of care, regardless of where they live or the treatment they need. Our two trusts are working together without merger or acquisition to streamline clinical pathways, reduce variation, and improve the quality of care. Our aim is to ensure that every patient gets the right treatment at the right time, in the right place, from the right people. It's no secret that pressures on the NHS are increasing. Financial constraints, as well as an aging population with more complex health needs, mean that we have to find innovative short- and long-term solutions to these challenges. Before the Foundation Healthcare Group was formed, Guy's and St Thomas's already had a number of working relationships with other organisations, including Dartford and Gravesham. Many clinical pathways already existed between the two organisations, but because they weren't created collaboratively, patients didn't always benefit from the fastest and most efficient route to treatment. So we sat down with each other and discovered that we share the same values, particularly our value of putting patients first and at the centre of their own care. Guy's and St Thomas's, as a well-established teaching hospital which provides a number of specialist services, was looking to expand its role as a system leader. Dartford and Gravesham, as a small acute trust, was seeking a partnership with a larger organisation in order to provide sustainable, high-quality specialist care locally. As there were already referral flows in cardiology, vascular and paediatrics, we thought this was a good place to start and see how we could improve these pathways together. We've now been working together as the Foundation Healthcare Group for just over a year, and the results have been very encouraging. The executive teams of both organisations coming together has really given our clinicians confidence to make the changes they want to see. Relationships between staff at both organisations have been strengthened, and improvements in patient care have been accelerated. Patients in Dartford are now receiving specialist care closer to home, which in turn is reducing the need to refer people to Guy's and St Thomas's. This not only reduces costs for the trusts, but it also saves patients a great deal of travel time. Clinicians in Dartford are able to access expert advice from specialists at Guy's and St Thomas's, which provides fantastic learning opportunities for our staff, as well as attracting a high-caliber workforce. And integrating our digital systems is making record sharing quicker and easier, which allows staff at both organisations to access all the information they need when patients arrive at hospital. We're not only focusing on improving patient care today, we're also planning for tomorrow. The Ebbsfleet Garden City development will see over 58,000 people coming to live in the Dartford and Gravesham area, and it's important that our hospitals are prepared to meet this challenge. By creating effective links between our two organisations and focusing on maintaining efficient, high-quality care, we're gearing up to meet the increased demand on our services. Our next steps are to continue improving clinical outcomes by working together to expand the clinical areas we're focusing on, keeping patient safety at the heart of everything we do, to continue listening to the feedback we're receiving from patients and involving them at every level when designing new services. This partnership is about bringing the best of both organisations together and building a sustainable partnership that will extend long into the future and can be replicated across the NHS.